Okay, welcome back after the lunch. And thank you for staying with us. To all the online participants, we are going to have our keynote now from Dr. Andrea Cattaneo. He is a senior economist at Food and Agriculture Organization, a UN entity, and he is leading a team that produces the State of the Food and Agriculture, which is FAO's flagship publication. We are very excited to hear more from this publication, which has just come out in 2024. And he has over 25 years of experience in examining economic issues and relating to development, food security, deforestation, and climate change. Extensive publication record, and his main interest area is around true cost of food. He has previously held positions at International Food Policy Research Institute, the US Department of Agriculture, and the Organization for Economic Cooperation and Development. So thank you so much, Andrea, for accepting our invite. And we are very, very pleased to have you here as our keynote speaker. So over to you.
Thank you very much for the introduction. It's a real pleasure to be here and have the opportunity to share this report that was just launched on the 8th of November. So I will go ahead and share my screen. So this is the theme of this year's State of Food and Agriculture report is value-driven transformation of agri-food systems. Now, this is the oldest report of the UN system. It started in 1947. It's an annual report, and it's for the first time in its history, it has had back-to-back issues on a big theme. So last year, we demonstrated in last year's edition that the true cost of food goes far beyond the price that we pay at the stores. And so this year's report kind of refines the analysis of SOFA 2023 that was launched a year ago of these hidden costs. But essentially that report built awareness, and now we're looking more into how do you move towards what do we do about these hidden costs. So last year's report basically found that global agri-food systems generate about $12 trillion in hidden costs. Now that is around 10% of the global GDP. So it's a sizable amount. And for some countries, it is actually very, very impactful in terms of lost opportunities. The significance is quite substantial across countries, and I'll touch briefly on this. The report covered 154 countries. The reason we did this is that to essentially to quantify these hidden costs is a first step towards understanding how to reduce them and have agri-food systems provide greater value to society. So just very rapidly, what was covered in these two reports. So we took an agri-food systems perspective. So we look at the whole agri-food value chain going from agricultural inputs on the left all the way to consumers and food waste. So we're looking at essentially the environmental, social, and health costs that are not captured in market transactions essentially, and therefore are hidden. Now, these costs are hidden, but somebody is paying them, either directly or indirectly, either today or in the future. And this is what we covered. So we covered on the environmental side, greenhouse gas emissions, which happen throughout the value chain, but also nitrogen emissions into air and water, and land use change. These are impacts, pathways that occur through primary agricultural production, as well as also nitrogen through food waste emissions. But also the social element is quite important. So poverty among those employed in the agri-food sector, and on the consumption side, people who are affected by undernourishment through poverty, who may not be working in the agri-food sector, but who nonetheless are part of a food system. And therefore, we try to capture that and productivity losses associated with undernourishment. And finally, we have hidden costs associated with unhealthy dietary patterns that lead to non-communicable diseases such as cardiovascular diseases and diabetes. and thereby cause a loss in productivity that is not taken into account when we measure GDP, global domestic product. So these are the three dimensions that we're capturing, and where we did through a pretty in-depth analysis of these costs, of the quantities, and then the shadow prices associated with these kind of damages. And what we found was that at the global level, as I mentioned, there's this 12 trillion in estimated costs. 70% are associated with unhealthy dietary patterns. About 25% are environmental hidden costs, and 5% are these social hidden costs, which are at a global level relatively small, but very, very important for certain categories of countries, low-income countries, countries in protracted crises. So just to give you a sense of the breakdown, we divided into six agri-food systems into six categories, going from protracted crises, countries in red that are characterized by prolonged economic, climatic, or political crises, and often food insecurity, through to traditional agri-food systems in orange that are characterized by a high share of calories from staples, relatively low productivity in agriculture, shorter value chains, and a larger rural share of the population. And then, as socioeconomic conditions change, agri-food systems transform from traditional to industrial, where industrial essentially are more urban agri-food systems with longer value chains, supermarkets, more supermarkets, and also different dietary habits in terms of having access to more processed foods. Um, so, and this is to present a kind of, since we can't present results for all 150 countries in a PowerPoint presentation, this gives a sense of these countries, how they vary across the spectrum. And this is what we found, right? And then, which was quite surprising for us. So that the burden of hidden costs varies substantially across agri-food system types. And that protracted crisis and traditional agri-food systems on the right are the one that are most burdened by hidden costs. Now, this was unexpected because when we started this work, we thought that hidden cost was really a bit of a rich country uh, idea project, right? That it's like, well, we thought that the environmental side would be really the one that mattered most, and that we would see it in higher income countries. So this result, I think, drove home the idea that this issue of hidden costs is something that affects really countries across the spectrum of development. And what we see is that the smallest share is in industrial, because obviously these are bigger economies, more value added per capita. And so agri-food systems are also a smaller part. The social dimension is not prominent there because people are not below the international moderate poverty line of $3.65 per day. But we see that in orange, the social dimension then becomes more and more important once you go into traditional agri-food systems and food systems that are in protracted crisis, where in fact, very often procuring food is a key part of livelihoods. So I think this is a very was a very interesting element of the diversity in this, and also that the entry points to solve these issues of hidden costs will change pretty substantially across these agri-food system types and countries belonging to these categories. Now, what we see also in blue is that the hidden costs associated with unhealthy dietary patterns are significant across agri-food systems, but particularly important as a share of the burden in industrial, formalizing, and diversifying systems. So in this report that was launched on the 8th of November, we broke down these health costs in 13 categories. This is based on information from the Global Burden of Disease Project out of the University of Washington. And we basically calculated the loss in productivity associated with disability adjusted life years associated with disease. And what we find is that depending, so some losses in productivity are associated with diets that are too high in some elements or too low in others. And so globally, diets low in whole grains and fruits and high in sodium are the leading dietary risk. Although clearly there are other risks that are listed there, which are also significant, and there's a substantial variation across agri-food systems and countries. And what we see, for example, in the protracted crisis type of country, we see that not that surprisingly, it is mostly an issue of diets low in fruits, vegetables, and whole grains associated with possibly poverty and undernourishment. Whereas in industrial systems, we have diets that are high in processed meat, also in red meat and sodium, but also low in whole grains and fruits. And this variation is also at the country level, where, for example, if you look at India and China, where you think over, large populations, it could be that these things average out in terms of, but they don't. So partly it's linked to cultural elements, and partly it's linked to the income levels and income distribution within countries. But we see in India, for example, it is very much more in the lines of traditional system, if you want, where you have diets low in fruits, whole grains, and nuts and seeds, whereas in China, very big problem associated with diets high in salt content, essentially. So what to do about this? I mean, in a sense, the next step going beyond these kind of global numbers is to do targeted true cost accounting assessments through country case studies. And so this involves inclusive stakeholder consultations because really to address problems of these magnitude, it is important to kind of incorporate these hidden costs in decision making. So involving policymakers, private sector, civil society, uh, and also consumers and researchers. And I think this is why it's particularly relevant also for this audience that the entry points are in many different dimensions. Now, we did a study with the Swiss Federal Office for Agriculture, which is using this approach to try and understand how to shape the policies out to 2050, and it's part of an official political process that will eventually undergo a referendum. And so that's been an interesting effort to see how does one incorporate hidden costs in the systems and then we did similarly some case studies with stakeholder involvement for Australia, Brazil, Colombia, Ethiopia, India, and the UK, looking at different scenarios and how these hidden costs would change. So I think really what comes out of all this is that the hidden costs, the distributional challenges are substantial, right? Because hidden costs affect different actors in very different ways. So one example, and we've seen it in Europe, I mean, primary producers, for example, often bear the burden of taking action linked to environmental impacts. But the beneficiaries of those actions are throughout the value chains and very often consumers. So who pays for that? And that's very tough political decisions to make. And that's why stakeholder consultation is needed. The local versus global hidden costs, that's another aspect. Immediate versus future, as with greenhouse gas emissions. Um, and then I think in value chains, in especially in more kind of industrial systems, asymmetric power relations can hinder a fair distribution of costs and benefits of kind of incorporating this in costs. And so kind of, looking at regulatory, financial, and market structures, whether they favor addressing these hidden costs or whether they maintain the status quo. And here I come to my final slide. Uh, and I see, what can be done? I mean, as I mentioned, there are the entry points that are, distributed along the value chains and where also different types of institutions can come in and contribute. So in the agri-food value chains, obviously kind of coordinated action among private sector actors, be they primary producers or along the value chain, um, environmental, social, and governance reporting, voluntary standards, labeling and certification, in terms of different types of kind of whether it's type of fair trade, in terms of making sure that people can make a livelihood out of what is being produced, but also environmental certification, and then in general compliance with laws and regulations, which is an entry point really for governance for governments. For consumers and institutions, we saw the health costs being a very big part of the issue. So this is something that is especially relevant on the consumer side. So consumer labeling, how products get marketed and promoted. We also cover institutional procurement guided by true cost accounting. So procurement by schools, by hospitals, by prisons, that can change the way agri-food systems function by changing demand for certain types of products and thinking about dietary patterns, as also improved education on food consumption decisions and the impacts they have. Finally, kind of on the policy, investment, civil society, and research, financing matters a lot, whether it's public or private. What gets financed? Does it favor, for example, the logistics for fruits and vegetables? What type of processing is being financed? Repurposing agricultural support for countries that have support to agriculture, which are typically high income countries or higher middle income countries, thinking how that can be redirected to reduce the environmental impact and reduce the impact on health of unhealthy diets. Social protection in lower income countries that is nutrition sensitive. And then finally, a lot of R&D towards sustainable production and consumption and thinking through, the barriers to adoption of R&D, which is often a big challenge in agri-food systems. So on that note, I finish here and I thank you very much for listening, and I'll stop sharing.
Thanks a lot, Andrea. Just out of curiosity, can I have a couple of questions for you?
Sure.
Okay. Are there any burning questions from the audience? Or I can start with my. Okay. So, Andrea, you showed the slide where you were saying that the industrial agriculture is more environment friendly than the traditional agriculture. So, are we suggesting that is the data suggesting to move towards industrial agriculture more, or is there any way to make the traditional practices more sustainable?
So actually, that's an excellent question. I mean, in such a short presentation, I had to privilege, let's say, I present the results relative to GDP. So obviously, if I presented the results in monetary values, industrial systems have higher health costs in dollars and higher environmental costs. But their economies are bigger, so as a share of GDP, it doesn't show up, right? So I think so. I mean, we actually make the point in the report that going from traditional to industrial is not per se a positive thing, right? And that in fact some negative effects of industrialized systems, the aspiration would be to bypass those negative effects, whether through education, through better certification. So it's not, it's not let's say, an endorsement of industrial agri-food systems per se. Although, I mean, there are benefits from industrial agri-food systems, such as food safety aspects, I think, that are big improvements, diversity in access to products, and so I think there's a good and the less good that comes with industrialized food systems.
Okay, brilliant. And in our room and in our network, there are a lot of data science people, and I'm sure they would be intrigued to look into now the SOFA 2024 report and look into the data and the data sets. If there is an interest coming from the community to take a deeper look into what kind of data modeling and data exercises have been done. Is there a possibility of connecting with you and your team together with a data scientist here in the UK or across the network and make sure that we understand the data a little bit better and maybe make use of the data as well for the future analysis?
Sure. So my team did not do the work directly. Actually, this is Stephen Lord out of the University of Oxford that has done the modeling and started well before we did the report. And in fact, also contributed to a Food Systems Economics Commission report on hidden costs of agri-food systems. So we are in the process as FAO and with Stephen to figure out how to essentially make this work more open and find a home for the different parts also because there are a lot of assumptions involved, right? So you have the nitrogen modeling part that is, needs one set of expertise, and then you have the social part. And so for sure, I mean, through us, we can act as a to connect with Stephen Lord if there's interest on the data set. There is let's say we do have a very simple kind of Excel file where we show the marginal costs and the quantities associated with these different dimensions for countries. It doesn't go into the detail, right? I mean, because there's a lot of modeling behind it, so that would be Stephen depending on in each dimension has a module where you're looking at how to quantify those effects. But yes, the aspiration is to make this as accessible as possible.
Thank you. Thank you so much, Andrea. So we have one more question.
Good afternoon. Actually, in your presentation, you had said that there are many hidden costs due to unhealthy dietary patterns. Can you elaborate a little bit more on that? That how the unhealthy dietary patterns are contributing to the hidden costs?
Yes. So we, and this is, again, it goes back that all these studies have some significant assumptions, right? So we try to make this comparable to something that people are accustomed with, which is GDP. So we said, okay, we take hidden costs that are not accounted for in GDP. So for example, we don't include treatment costs because treatment costs paradoxically are part of GDP because they come into healthcare consumption for healthcare, right? So these are productivity losses associated with disability adjustment life years that are lost. And this comes from the global burden of disease studies. So we take that with the dietary risks associated with non-communicable diseases. And then what we do is that we multiply those by essentially the average wage in a country. So what that means is that, and this is controversial, right? I mean, this is something that I mean, one has to make a specific assumption or not, but you are implying that essentially the productivity loss in a country like Malawi, if you're quantifying it in dollars for the same number of days that are lost, is lower, right, than the same number of days lost in Italy, where I live, where the average wage is higher. But that is how it was done, right? And then this is all in purchasing power parity. So, I mean, it makes sense within the context of a country. But once you start adding up the dollars, it can look a little bit strange that in fact some of these hidden costs are in a sense discriminating against people who have lower wages, right, in terms of how we calculate them on average, right? But this is how it's done in terms of trying to come up with with a system, but is in any case consistent within a country based on the impact that it has, that these hidden costs have relative to the GDP of that country, right?
Right. So I'm interested in, suppose I'm a government in one of those countries that you had on your world map. And I have a certain set of constraints in how we do agriculture and how people tend to sort of economics and the kind of land use I have in my country. And suppose I want to reduce the hidden costs, like, and I have some controls. I can, in the UK, maybe DEFRA can do something, but it wouldn't just be DEFRA because it's an incredibly complex problem. The Treasury will have a say, the healthcare, the culture. We were talking over lunch about how we eliminate food waste in our households and how different countries have different ways of doing this. And I'm just wondering whether we could have something like a toolkit where what you can actually do as a government, given the complexity. You span different departments, and on the other side, you have multinationals coming in with their sugary drinks and their high fat, high salt burgers and stuff. Do you think there's a kind of a toolkit you can give the government to with limited controls and say, here's how you can start chipping away at the hidden costs and maybe improve your population health?
And that's a tough question. I mean, I think in part it depends on the agri-food system for the country. And I'll give you two examples. One is, let's say that you are, let's say, Burkina Faso, right? And where cocoa is very important. So you could focus on the value chain, right? To say, well, you know, we have poverty in the value chain, and we try and address that, and we and there have been efforts already like that. And so that would be one way of saying, okay, this gives you a general sense of a problem. Let's focus on one aspect, which is in that case a value chain. I think for more complex agri-food systems, and we've seen this with a Swiss case study, right, where it is a part of an active policy process. I mean, this is the government that is using this to write policy, right? And I think what was most interesting to me is that this approach kind of brought together people from different ministries, and they had to fight over stuff, right? And they had to decide, okay, they had to agree on the assumptions, and which assumptions they were not okay with. So they changed them, right? And so they're doing their own analysis now, where the starting point, they validated the numbers that we produced, but they said, oh no, we also want to know about pesticides because pesticides were not included, right? And also we want to know more about kind of the hidden costs of our imports. And I think that sets in motion a process where, you know, that people start picking up on things that can be done. A toolkit for more complex agri-food systems, I think, would be very difficult, right? I mean, I think, sure, some things you can take a little bit off the shelf, you know, nutrition education, procurement. I think the institutional procurement aspect is one that is undervalued, right? I mean, it's being done by the state of New York, for example, that they are taking into account these hidden costs when they do procurement for all their food expenditures, right, which are pretty substantial, right? I mean, the state of New York. And so that changes the way the state of New York demands for food products. And so it buys more whole grains, it buys more fruit, and it may buy more fruit that is produced in a certain way. And so I think that is an area where pretty advanced agri-food systems can actually start chipping away at the problem in a way that is not too controversial, right? It's a little bit like reducing food loss and waste. It's difficult, right? But everybody agrees that you want to do it. And I think this is a similar type of thing where institutional procurement could be an entry point where everybody agrees, right? In a situation where instead, very often, especially across ministries, there's little agreement on what the priorities should be.
Yeah, thank you, Andrea. I think just one final questions on the role of FAO, because we have seen food and agriculture organizations promoting certain crops as International Year of X, let's say. It happened with quinoa as well, to introduce in the diet about a few years ago. And then we did see, after International Year of Quinoa was announced by FAO, there was a slow and steady movement in terms of increasing the production as well as in the consumption and making people aware of it. Now, last year was International Year of Millets, announced again by Food and Agriculture organizations. Do you see any sort of dietary changes coming in as a result of that? And what could we do together to make sure that there is more fiber in our diets?
Well, I think I'm not sure how much there is a causal relationship between the International Year of. I mean, it's nice for us. It would be nice to think that there is a causal effect, but it might just be also that we're picking up on a process that is already happening. I mean, millets, I guess, are very important in some countries like India, for example. I believe it's, but I do see a general shift in the narrative about putting much more emphasis on nutrition that goes beyond kind of undernourishment or issues that link to things that we associate with poverty, just to more generally kind of having a good, healthy diet. Right? I mean, FAO now produces, a number of people who do not have economic access to a healthy diet, which means the ability to have enough micronutrients, fiber, and everything that goes with healthy living. So I do see a general movement in that direction. In terms of what can be done in terms of together. I mean, I think there's so much. I mean, every type of institution has in a sense, a role to play. I mean, whether it's kind of university and schools and on the education side, there's a lot of research in science. I mean, fortified commodities where you can you can improve some of these shortcomings in diets through specific kind of technological innovations. You know, governments, certification, labeling, food safety. I think so. There are many, many different areas where I think in terms of our ability to improve people's diets are there, and they're very different across the world. I mean, in some places, people not having economic access. In more advanced economies, it's people having the money but not choosing the right things, and that goes back to what the other question was about, kind of agro-industrial, kind of big companies pushing stuff on us. So it's tough. I mean, it's a complicated problem, but I think it's one where we're seeing a big shift in how people in how policymakers and I think people across the spectrum are thinking about these issues.
Well, thank you. Thank you so much, Andrea. I think it was wonderful listening to you, and what a beautiful insight you have given to so far the 2024 report. Thank you. Thank you so much.
Thank you very much. It was my pleasure. Have a good continuation. Bye-bye.